Hello, my name is Dr. Ruth Newstifter. I am a professional sex educator. Most folks just call me Dr. Ruthie. I blog over at exploringintimacy.com, do workshops all over the place, and I'm the author of The Nice Girl's Guide to Talking Dirty, which is available online and in major bookstores and all that good stuff. I am here answering your questions on sex and relationships, thanks to the fantastic folks over at funwares.com. So make sure you head over there and say thank you for me. If you want to send me a question, you can send it to Ask Dr. Ruthie at funwares.com, AskDrRuthie at funwares.com, all one word. And or you can send it to me by Facebook or Twitter at the information on either side of this video. I will look forward to getting your questions and answer as many as I can by video each month. All right, here is our last question for the series for this month, for October. Dear Dr. Ruthie, I am a girl who gets regular UTIs, and my doctor said it may be from sex. What does that mean, and what can I do? Urinary tract infection, that's what UTI stands for, otherwise known as a bladder infection. You know, you have it because it feels really uncomfortable right before, during, and especially after urination. It doesn't feel like your bladder ever gets all the way empty. There's this terrible, like, burning or knifing pain, and there may be blood in your urine. It's very important that you get to a doctor right away if you're having any of these symptoms, and that you get tested for a bladder infection or whatever's causing the problem. An untreated bladder infection can go up into your kidneys or may already be there, and that can be quite bad. It's easily addressed with regular old oral antibiotics, so with pills, and they can take care of it for you. So I'm so glad, reader, that you went to your doctor about your UTI and that you were talking about how these things might be happening. Regular UTIs, some women get them every month. Some women get them more than once a month. Some women get them several times a year. You know, it's just kind of the way our bodies are built that we're more susceptible to bladder infections than the male anatomy. This is unfortunate, and it is a very unpleasant experience. There's different things you can speak with your doctor about. So everything I bring up here, I want you to take that back to your conversation with your doctor and check in with her or him. These are just ideas to contribute. First, though, let's explain what they meant by UTI can be caused during sex. It's not a sexually transmitted infection in the way that somebody else had something yucky and gave it to you. Yes, it's possible that your partner had a bladder infection or some sort of bacteria, but it's not the same thing. It's an infection that can happen in lots of different ways that are not sexually related, but sex can kind of push the bacteria into that area. So it may not be that your partner has any kind of, typically what we think of as an STD or an STI, like herpes or gonorrhea or HIV or one of those. Sort of like if you get a yeast infection from your partner's yeast, it doesn't mean that they've been exposed to someone else. It just may mean that they have the bacteria themselves. Okay, so this is your vulva. Well, this is not your vulva. This is Venus, my stunt vulva, and she's going to represent your vulva to talk to you about where your urethra is located and why sex might have had something to do with your irregular urinary tract infections. Okay, so this is the outside. This is where all the pubic hair grows and these big outer lips. The shiny material on the inside is the inner lips. They can be lots of different shapes and sizes, and they're generally not symmetrical. This is your clitoral hood. It may be very flowy and lots of tissue, or it may be very slight, may not even be noticeable, anywhere in between. It's all healthy. It's all happy. It's all just perfectly, wonderfully, sexually functional. Not a problem. No need to have surgery, ladies. You're beautiful the way you are. The clitoris is under this clitoral hood. It may be clearly visible or it may be hidden. And a lot of people think that the urethra is like your pee hole, that's the urethra, is like somewhere up here. It's not. It's way, way, way down here. This is the vagina. And if you'll notice on this model, there's little fabric rows. I'm going to zoom you in. All right, super enhanced vulva cam right here. So clitoris, clitoral hood right up in here, and there's just kind of this like smooth area, and then the opening of the vagina is right here. And that little rose, that little pink rose, this other, here, let me unfold the vagina. This other pink stuff inside the vagina is the G-spot, but this little rose right here at the very opening of the clitoral side of the vagina, that's where the pee comes out of. That's your urethra or your urinary tract for your urinary tract infection. So it's right up here at the opening of the vagina, right at the top. In fact, if you took a mirror, it'd be kind of hard to see it unless you held up the mirror while you were peeing, which you could do if you want to. I would suggest the tub because there's going to be lots to coordinate, but whatever works for you. And then when you're urinating, you may be able to see the hole where the urine comes out of. But generally speaking, it's kind of hard to find your pee hole. It's really tiny. So what does sex have to do with getting a urinary tract infection? And when your doctor said sex, that includes sex toys and masturbating too. It's not that there's anything dirty or contagious about masturbating or sex toys, or even about sex with a partner who, has no STDs, especially if you're using protection or whatever. It's that the rubbing of bacteria gets into that urethra. So it's at the opening of the vagina. So if you're using a sex toy and you're, going to town with that insertable sex toy and it's rubbing up against the urethra opening, right? It's rubbing right up against that spot like that. And so if there's bacteria in the area, it's rubbing right into the urethra, and that bacteria is what's causing the bladder infection. So rubbing that area, agitating it, pushing bacteria, because the stuff that causes the bladder infection is like bacteria that's just kind of hanging out in the area anyway. We just don't want it in the urethra. So that's what's causing it. What can you do? There's a few different things. One, when you're done, immediately, before you hug and kiss or anything, leap up and say, I gotta go to the bathroom, run to the toilet and push out all of your urine. Actually do a little, not, don't strain yourself, but put a little pressure into that, a little oomph into that urination, and get even just the last couple of drips out of there. You can go pee before having sex or masturbating, but there'll be a couple of drip drops that have formed during that time. Push that out. That helps to clear some of the bacteria out of there. Drink lots of water in general. What? I don't like water. Find a way to like water. Not soda. Some people like coconut milk. Some people, or coconut water, whatever you call it. Some people like, Crystal Light or whatever. But you want to be drinking a lot of water. And if it can be just plain old, tap or filtered water, all the better. Because urinating regularly also helps push out that bacteria, even when it's not sex time. But going pee right after you have sex is important. Avoid using products that have been known to increase the risk of bladder infections, like fabric softener or underwear that doesn't let you breathe very well. In other words, you want that like nice cotton crotch underwear type stuff. Pantyhose and Spanx that just keep you all bound up. That sort of thing it can increase the risk as well. Make sure you clean your sex toys, please. Research shows that a lot of people don't clean their sex toys between uses. It's just you. It didn't go to anyone else, so it's not a problem, right? It still has all of your juices on it, all of the bacteria that hang out in the rest of the areas of your body, and it grows more bacteria, and then you're rubbing it against that area. If you have a male partner that you're having sex with, if you're not using condoms or some sort of barrier like that, make sure that they're washing themselves. So make sure that your sweetie is taking a good shower, male or female, and washing their hands really well before they get busy with you. While it can be sexy to have that fresh from the workout smell, a clean body against your body is going to help. Make sure that you're rinsing off any soap off their body and ears as well anytime soap is applied in the genital area. So give it an extra good rinse and making sure everything is clean. Make sure that you're using a body safe and friendly lubricant, a good water-based one, and that you're just keeping things as clean as possible. That means not leaving soap residue, so you may want to be careful with like baby wipes or anything like that. You want to rinse with nice, cool, clean water. I'm Dr. Ruthie. Of course, I am not a physician. I'm a doctor of child and family development. So take all this information to your family doctor or your gynecologist to talk about all this. But hopefully, this helps to give you some answers about what a UTI is and why your doctor said it may have something to do with sex that you keep getting them. Keep on talking to them, work out proactive ways for you to deal with these current recurring bladder infections. They're so uncomfortable and unhappy. Keep talking to your doctor about it. I'm Dr. Ruthie. I hope this answers your question and helps you to be much more comfortable, and I will see you at the next video.